Hi there, my name is Kershina Stansel. I am a MSN student in the NR660 capstone course at Chamberlain College of Nursing at Chamberlain University. I'm in the March-April 2018 cohort, and I'm here to present to you some of the benefits of simulation-based learning and how you can incorporate it into your classroom. Chamberlain campuses have a huge simulation-based learning lab, and I'm going to take you around to show you some of the high fidelity mannequins we have. But if you don't have a high fidelity lab or simulation lab, it is some ways you can incorporate simulation to your classroom, and I want to show you those things here in a second. So I'm going to turn the camera around. I'll be right back with you. So what I have for you right now is what I call the antidotes and reversal box. Now, if I was to teach a pharmacology class, I would bring some form of medications so the students can play with. Not just, we just don't want to talk about the medicine and test it and do examination all day, even though that's very important. I would want them to see and feel and draw up medicine and give medicine as if it was a real order, okay? So I guess I could give the students a scenario of, so let's say that your patient had a 6.0 potassium level, and now I would have one student come up and give one of these medicines in this reversal, aka antidote box, and I would see which one they would select. Now we would hope that they would select the K-exalate, and then I could say, okay, that's correct. So K-exalate can be used for a 6.0 potassium level. We can also ask about the pharmacokinetics of K-exalate. How would they excrete K-exalate? What are some signs and symptoms of someone having a 6.0 potassium level? So we could dive into pharmacology as well as assessment symptoms and signs, and just lab values and a gamut of things. So hopefully they can give me, I can get them an order for like I guess 15 grams of K-exalate, and they would have to pour me 60 milliliters of K-exalate in a cup. So that's how we would test dosage administration as well. Safe administration of using a safe method to administer medicine, using the 6 rights of medication administration. Now, I'll have them go through this box and tell them, and I could give them another scenario. I give them scenario of a patient just received 5 milligrams of morphine intravenously, and now the respiratory rate is 8 breaths per minute. The pulse is 50. Blood pressure is 88/40, and SpO2 is 88% on room air. Now, I would ask them to select the medicine that would perhaps help with this, the signs and symptoms that this patient is presenting. Hopefully, they'll choose naloxone or Narcan, and I could ask the student to give me 0.4 milligrams of the naloxone, aka Narcan, or even more. Okay, I could ask the student to give it intravenously if the patient did have a IV. Okay. Other things I like to test about is what is the antidote to Coumadin? We have vitamin K. We also have what's the antidote to antidote to heparin, which is the protamine sulfate. We have the antidote to acetaminophen overdose, acetylcysteine or mucomyst. And one of my faves that they always forget about, or sometimes, I can't say always forget about, they usually forget about this medicine. This is flumazenil, aka Romazicon, used for benzodiazepine overdose. Now, I can use that same scenario about the naloxone, about the patient having 8 breaths per minute, blood pressure 88/40, SpO2 88%, but the patient received 5 milligrams of lorazepam 20 minutes ago. So that'll be a good way to ask the question as well. So I'm going to get another fun box and show you how this could be incorporated in a diabetes scenario. So here is my other box. Now this box is dedicated to diabetes. So I will have some students tell me about some of these items, or I could start just giving them signs and symptoms. So let's start off with some signs and symptoms. So let's say your patient's blood sugar was 60. They're a little, diaphoretic and maybe a little confused, but they are able to swallow, eat, and drink. They are able to swallow, and they're not unconscious. So which of these items would you be able to give? So hopefully they will pick this one, the fast-acting carb. This is fruit punch. It usually say give a 15 gram item, carbohydrate item, and this has 22 grams. So maybe if we have like milk or something on the unit, or here at Chamberlain, this they will pick that. But this is a fast-acting carbohydrate to someone who is alert but has low blood sugar. They should give me the signs and symptoms of hypoglycemia, as well as they should know that after they intervene by giving them the juice, that they should reassess the patient and check the blood sugar after 15 minutes. So I like to use the nursing process a whole lot. So I tell the students, once you assess your patient, you have to do an intervention and then reassess to make sure that intervention even worked. The other thing I would like to discuss, if the same patient had a blood sugar of 40 and they were unconscious, but they had an IV, what would you want to give for that patient? And hopefully they will pick the dextrose 50, and they will insert that IV or push that IV, or maybe the glucagon. Okay, you give that IM. Okay, it says glucagon emergency kit for low blood sugar, and it said it's a simulated item. Okay. Now we could go to the diabetic oral agents. This is glucophage, aka metformin. Now I would ask students, can you tell me what you would tell me? I would ask the students what they know about metformin, and one of the caveats about IV iodine. That's very important, so to prevent lactic acidosis. So I would ask the students about this medicine. I know it's a first line agent for new diabetics. Maybe they don't get the insulin first and foremost, but they get metformin, and maybe if they were going for an IV contrast test, to hold this medicine, metformin, 48 hours before, and maybe even 48 hours after the procedure. Maybe they need to reevaluate the renal functions before they implement this back into the medication regimen, but that's something that they would have to ask the doctor about. Okay. The oldie but goodie, the mixing of NPH and regular insulin. Now, I like to tell the students to remember the acronym, and I did not make this up myself, of course, but I've seen it in a YouTube video. Remember the acronym RN. Regular insulin first, then the NPH. And our NPH is cloudy. I don't know if you can see that, as compared to just the clear bottle. Let me see. Okay. They always get this. Is clear cloudy first or cloudy clear first? I would have them remember what they're going to school for, RN. So they can insert air into the NPH first, and then air into the to the regular insulin first, then draw back what the physician ordered. So let's say that the physician ordered 10 units of NPH, 10 units of regular. So I would tell the students, or I would have them ask I have them tell me. They would inject 10 units of air into the NPH, then 10 units of air into the regular insulin, draw back 10 units of regular insulin, and then draw back 10 units of NPH. Now, I would ask the students about Lantus. Now, this is an off-brand Lantus because we can't officially use the brand name for what I hear. So I asked the students what they know about Lantus. And hopefully they could tell me that it doesn't have a peak and, you know, things of that nature. And we can go more and so about diabetic agents. I like this little box. It's not it doesn't really cost a whole lot to implement this into a classroom. It don't take a whole lot of time too. But to see students actually try to connect these things, like if I was to just do this, how I want to say this, if I were to say, oh, your patient has a blood sugar of 40, here, you know, it'll be in a box. Here, give this to the patient. They would not really know how to connect it. Maybe not, maybe they will. But I like to have these items so they can really touch and see and look at it, you know, and just not just talk about it like in a traditional classroom when you're just reading off a PowerPoint. I want them to actually touch and see, okay? You have the glucagon kit. It actually has a little diagram in here to show the students how to use it. Now I'm going to take you into the simulation lab where we have high fidelity mannequins, and I'll be right back with you. So right here is one of our high fidelity mannequins, fully equipped for the students to obtain vital signs such as blood pressure. They can auscultate the blood pressure manually. They also can auscultate the respiratory rate, auscultate the apical heart rate. We also have pulses that they can palpate to get a pulse, and we can make the mannequin do multiple things such as, so she can moan, vomit, have some shortness of breath, can have pain. So I know that's kind of loud, but we can also, what I'm using right here is a simulation pad. We can also make the patient have adventitious breath sounds, which is important for assessment purposes, such as a patient that's having a asthma attack. So we could put wheezes bilaterally, and if we get real quiet, okay, you may need to auscultate that, hear it with a stethoscope. Let me see. There we go. Okay, so I just turned her down a little bit. Now I'm going to show you how we have a monitor over here, and we can use this monitor for our critical care students or students that's learning EKGs, okay? So we have a lovely normal sinus rhythm, fully equipped with a nice heart rate, SpO2 98%, respiratory rate 12, pulse rate 79. If you want to, we can have a blood pressure right here. But I like to use this monitor for EKG purposes. So I can show you how to do different rhythms on this monitor, and we can test the student that way. So we could put a rhythm up and say, what would you do for a rhythm like this? Okay, so first and foremost, they would have to classify this rhythm. Okay, so this is our VFib. It's actually not even giving us a heart rate, okay, or much of anything. Respiratory, they're giving us respiratory rate of 5, 4, and no heart rate. So this patient does not have cardiac output or very little cardiac output. And right here we have a crash cart fully equipped with medicines. such as our favorite epinephrine. Okay, so I'm not gonna fully, if they wasn't senior students, this is more for the senior students to the monitor. But we can also do other rhythms, of course. We can do, let's do, now we do have other mannequins, including this mannequin here. We call him PD Hal. He is also fully equipped for blood pressure and all the vital signs that we can use on the bigger mannequins. Now these are still considered high fidelity mannequins. He also is can say things like "Don't touch me" and "Leave me alone," just in a child's voice, and it's quite interesting to see how the students will interact with a pediatric patient versus a patient that's an adult. So this is another mannequin we have. This is actually a birthing, not a birthing mannequin, but she does have a abdomen that kind of resembles a fundus. Okay, so we can have students that's in OB massage the fundus and get lochia, perhaps. Of course, I'll be wearing gloves. This is kind of like a bad example because I always tell the students to wear gloves, even if they were, touching the mannequin, because we want to pretend like it's a real patient, right? So we can have students massage the fundus and hopefully do some postpartum care on a patient that just had a baby. Now that I show you briefly on how simulated items can be used in the classroom during lecture, do you have any suggestions regarding simulation-based learning?